So welcome to session 2. In this session, we're going to talk about induction of labour. We're going to talk a little bit more about the pushing stage, the second stage of labour, to include help that you might need for that stage. We'll also have a little think about Caesarean section and making decisions, which is a big thing when you become parents, and also a bit about pain relief too. So you could go into labour naturally any time from 37 weeks of pregnancy, and that would be normal. There's many reasons why you might be offered this thing called induction of labour, where we start labour off artificially. All women are offered induction once they go 12 days over their due date, because the chance of a baby not doing so well does increase slightly once you get to 14 days over your due date. Other women may have other indications such as diabetes or another problem with the mother or the baby. There's too many things to list really, but the process of induction is the same regardless of the reason for induction, so we can focus on that. When you go for induction of labour, it's good to remember that it is a process and it can take 2 days or longer. So it's not the case that you would have induction and meet your baby that day. That would be quite unusual. In this slide, you can see a picture of the cervix before labour again. So if you were joining us for session 1, you'll remember that it's like a long closed tube in front of the baby's head. In order to get into labour, we need to soften that. And sometimes your natural hormones can do that. And we will maybe encourage that process by doing what's called a membrane sweep. So to do a membrane sweep, we used a glove finger to stretch the cervix and stimulate your prostaglandin hormones. When you have a sweep, it might actually be something that you have in clinic where you see the midwife or the obstetrician, or at home. And that sometimes encourages your body to go into labour. If you need to come in for a sort of more formal induction of labour in hospital, we would use hormone tablets. Hormone tablets are placed in the back of the vagina behind the cervix to encourage the same thing. We need to change the cervix from being firm and long and closed to soft, short and open. And the bottom picture shows you the change. So if you have a look at the top picture, it's like a long closed tube in front of the baby's head. And in the bottom right picture, it's a thin tube that started to open up to about 1 centimetre. So there's an awful lot of work that the body has to do before labour. And this is this process of induction that we use hormone tablets for. So with hormone tablets, it is a process. We can use a tablet and then 6 hours later, we will check to see if you need another tablet. And we may do that 2 or 3 times. So the whole process can take a day or 2, as I said. Sometimes we'll use 2 or 3 hormone tablets and still not get to the point where we need to be. So the next stage of induction is to break your waters. And if the hormone tablets aren't quite enough, then we may use something called a balloon catheter. I've tried to put some pictures of how that works underneath. So in the bottom picture, you can see that the balloon catheter is 2 balloons. And actually before we start, there's no water in them. So it's actually just, to begin with, it looks like a tube that's passed through the vagina and through the cervix. And then with the taps that you can see in the top picture, the colourful ends onto this device, we inject some water to inflate the balloons. So one balloon, as you can see in the bottom picture, is inflated just in front of the baby's head. And the other balloon sits at the top of the vagina. And those 2 balloons cause stimulation of your natural hormones, a bit like a membrane sweep would, so those natural prostaglandins. We keep that device in for up to 24 hours, and during that time, that encourages your natural hormones to do their thing. At the end of that time, we remove the water from the balloons and then slide the tube out to see what the progress is. The next step of the induction process is to break the bag of waters around the baby. This is done during a vaginal examination using a small hook. Once this has happened, you'll notice amniotic fluid leaking out until the baby's born. The fluid should be clear, but there may also be some mucus, which is sometimes blood-stained. Occasionally, labour will start at this stage, but if not, we gain access to your vein with a cannula and begin a hormone drip to give the muscle contractions. Women are unlikely to feel much different after the first 2 hours on the drip because it's increased very gradually. We're aiming for 3 or 4 or 5 contractions in every 10 minutes for labour. The progress of labour will be checked every 4 hours if contractions are good, or more often if we think there's any problem. Remember, the first stage of labour can last for 10 to 12 hours. Your baby's heart rate would be continuously monitored with a CTG machine for this process, so induction is a bit more medicalised than a spontaneous labour. So the second stage of labour is when a baby's born. We often call it the pushing stage. It starts when the cervix is fully open, we say 10 centimetres, and it's finished once the baby's actually born. It's normal for this process to take an hour or 2. It can be a bit longer if you have something like an epidural. In the pictures, you can really see how the baby's head changes shape to make being born easier. Swelling or unusual shaping of a baby's head usually resolves itself very quickly after the birth. If you were joining us for session 1, you'll remember how the baby's head can be quite cone-shaped as it fits through the pelvis, and you'll probably remember me saying that sometimes the head can be born and then you'd need to wait for another contraction before the rest of the body's being born. And the babies tend to bring one shoulder out before the other to find the best fit to make it easier. And if you're lucky enough to see a baby being born, you might see them do that wonderful quarter turn to wriggle their way out to meet you. If it looks like the second stage, pushing, is taking much more than 2 hours, or if there are concerns about the baby, then the obstetricians may need to consider an instrumental or caesarean birth. So firstly, instrumental birth is usually the quickest way of getting your baby born. And there's 2 methods for that. First, in the picture, you can see what's called a ventouse suction cup. So there's different styles of cup, but they work by a measured amount of vacuum onto the baby's head and the obstetrician pulling as the mum pushes at the same time. The other instruments that can be used are obviously forceps, and the second picture shows you how the forceps are like metal salad servers that cup the baby's head as you push. The obstetricians can also pull to deliver the baby's head, and then they're taken off to deliver the rest of the body. People often get very nervous about forceps, but what you need to know about them is that they're in a fixed position, so they can't actually squeeze the baby's head. They're fitted around and the handles lock together, so they can't move closer to each other like scissors. It doesn't work like that. But after any birth using instruments, you'll usually notice some evidence of that on the baby's head. So you often will see some bruising where the forceps have been, or a bit of a suction cup mark where the ventouse machine has been. And although none of us like the idea of that on a baby, what we have to remember is that in the grand scheme of things, these things are superficial, so bruising will heal, in a few days' time. But if a baby needs to be born quickly, then obviously it's really important that that happens. A caesarean section can be much more complicated during the pushing stage of labour, so it is usually quicker and safer to deliver a baby with instruments through the vagina. A caesarean section is major surgery for mothers, and it really is a last resort if vaginal birth is not possible. So if a procedure in theatre is needed, it can be a bit daunting, so it's perhaps useful to know a bit about who will be helping and how this might look. There might be lots of staff you haven't met before. In this picture, I've used some plain bill figures to show you who may be there and sort of give a brief introduction to what they do. So at the top, you can see we have the operating department assistant, and they're there to help the anaesthetist. So moving down underneath, I've got a little figure with an anaesthetist. The anaesthetist is the doctor in charge of keeping you comfortable and looking after you throughout the operation. So they will usually perform your anaesthetic, either a spinal, which is a one-off injection into your back to make you numb from the top of your bump to the tips of your toes, or more rarely a general anaesthetic, which is where you go off to sleep for any procedure. Underneath that, there will be, you can see a midwife. So there'll be at least one midwife in theatre with you, usually the midwife that you've already got to know, and a theatre team lead underneath her. So that's usually somebody in charge of the theatre team, making sure everything runs smoothly and coordinating everything that happens and keeping all the records straight. Next, we have a healthcare assistant, who's somebody who's not surgically scrubbed and gowned, but who can help us move you from your bed onto the operating table, who can help us move equipment or gather things if we need them. And then moving across, we may need a paediatrician, which is a specialist doctor to help your baby after it's been born. Above that, you can see a scrub nurse. So that's a nurse who's surgically scrubbed and gowned to actually help pass the instruments to the obstetrician who's going to do the operation. I've put in another midwife because generally we have more than one midwife in theatre and to help. Above that, going round, we've got an assisting doctor and an obstetrician who will be the actual surgeon for the operation. So one of those doctors on each side of the operating table to actually assist with the procedure. So there's quite a lot of people in theatre. And in the centre picture, I've tried to show what some of the equipment layout looks like, just so that you can see that in advance. So in the picture here, you can see a mock-up with my Playmobil figures of what the operating theatre might look like. Sometimes caesarean sections are needed urgently to deliver your baby. We call these emergency caesareans. Other times it might be a planned operation known as an elective caesarean. We can only do these at West Cumberland or the Cumberland Infirmary, not at Penrith Birth Centre. Usually a woman will be awake for the operation and have what's called a spinal anaesthetic. So that's a one-off injection into a specific place in your back to give around 4 hours of pain relief. If we can manage a spinal anaesthetic, then one birth partner will be able to be with her in theatre. If this isn't possible, then the anaesthetist may need to use a general anaesthetic where the woman goes off to sleep for the birth. Unfortunately, it's not suitable for the birth partner to come with you into theatre for that. However, we would aim to reunite them with the baby as soon as possible after the birth. Birth partners are seated next to the woman, as you can see in the picture here, but will not have to see what happens during the operation if they don't want to. My Playmobil set doesn't have the screen that we actually use in our hospitals, where you would put that across at sort of chest height, so you didn't actually have to watch the operation. Playmobil don't seem to make one of those. We encourage you to have skin to skin with your baby in theatre, but obviously that's your choice. And if you don't manage to have that in theatre, you can always do that when you get back in the room to recover afterwards. The whole procedure usually takes just over an hour, and then we bring women back to labour ward to recover for a while. We would expect a mum to be in hospital for at least 24 hours after this operation, but every case is different. It's worth pointing out the length of stay after any birth is difficult to predict, because sometimes babies need treatment too. Sometimes babies will need some help to start breathing after they're born, and in these pictures I've shown you the equipment that we would use in a hospital setting to do that. We will always try and explain what we're doing and why, but sometimes we have to act swiftly and explain afterwards. Babies have to adapt from being inside in amniotic fluid to being out in the room breathing air. Most babies just need to be dried off and kept warm, but some will need help to push the fluid left over in their lungs out in order to take in air. So next I'm going to have a look at something called Brain, and this is a decision-making tool for situations where you need to make a choice and you want to weigh up what there is to know. It can be harder to use it in an emergency, but those times are rare. There'll be lots of things that you need to decide on during pregnancy, during labour, and indeed when you become parents. And it's good to just have something like this to weigh up your decision-making process. So you need to ask the right questions to get the information that you need, because you can't be expected to know everything about labour and birth particularly. So B stands for, what are the benefits or advantages to doing this? And if it's something like induction of labour, you may be able to apply this tool to help you make your decision. So benefits might be that the baby is born sooner rather than later, for example. R stands for what are the risks or disadvantages of doing this. So with every benefit, there will also be risks. With every plus, there'll be some minuses. That's just life. And we need to weigh those up to help you make your decision. The A in the brain stands for what are the alternatives. So there may be other options that you haven't thought of. It may not be a choice of one or two things. There may be some other options which are worth exploring. So the A part of brain stands for what are the other options? What are the alternatives? The I stands for intuition. And this is the bit that makes it individual to us. So we've all got different beliefs and feelings about things, and that's why each of our decisions would probably be different. If we go to the supermarket, we choose different products based on what we fancy, what we think is good, what we think is nice, and things that we believe in. So nobody else can make that decision for you. It has to be you. So the I stands for intuition, your beliefs and feelings about whatever it is that you're choosing. And the N in brain stands for doing nothing or negotiating. So what happens if we do nothing at this point? Or what happens if we negotiate something that we feel happier with? So this is a decision-making tool that you might use just to slow down that process of making a big decision where sometimes you wouldn't get a dress rehearsal. So if it helps you, then you can use your brain. So now we're going to have a look at some of the different pain relief options that you have. At Penrith Birth Centre, you can bring your own items, such as a TENS machine, and you can have gas and air, or Entonox is the brand name for that, and you can make use of the birth pool. This is similar to what you would have at home if you ended up hiring or buying your own pool. So those kind of options for the two places at home or at the birth centre are fairly similar. At West Cumberland Hospital and the Cumberland Infirmary, you've got some further options, which are injections of pethidine or morphine, which can help you relax, or an epidural, which aims to take the pain away. A birth pool's not suitable for everyone in hospital. It just depends on a few things that we can discuss with you. So if we consider that we need to do some more complicated monitoring of your baby, if there's a sort of a reason why perhaps we need to induce you and we're a bit concerned, then it might not be suitable to use the pool for pain relief. But we can talk to you about your individual circumstances at the time. So in the pictures, you can see at the top there's a birth pool, which is bigger and deeper than an ordinary bath. And we keep it about body temperature so that you don't get too dehydrated or dry out. And that can be really nice to help you relax. And it can mean that you can change your position to use one of those upright, beneficial for gravity positions that we talked about before. And some people actually give birth in the water, which is fine because your baby, remember, inside the body is in water, so it can be born into water and then lifted out. Or you might choose to use the birth pool for pain relief and then get out to do your pushing stage, and that choice is all up to you. And in the picture underneath that, you can see somebody with a gas and air mouthpiece breathing in gas and air, and that's something that you can combine with most other things. So you could be in the birth pool and use gas and air at the same time. So those things can go quite nicely together. And some people find that they just use gas and air and don't want anything else. Everybody's different. There's no real way of being able to predict what you will want and need. So it's good to know about all your options really, so that you can keep an open mind. In the picture underneath, you can see somebody using some massage on the lower back. Some people do seem to have a lot of backache in labour, and that can be down to the position that your baby's in. So any massage that feels good, pressing on your back, holding onto your hips, or heat packs, things like that, anything that feels good is going to be a good thing. In the middle picture at the top, you can see somebody having what's called an epidural. And this is a slightly more medicalised procedure, and it's done by an anaesthetic doctor who comes to the room where you're having your labour and will go through the procedure in terms of any risks and benefits with you a little bit more formally, and then clean the skin on your back and get you to sit in a sort of hunched over position and they will numb the skin on your back. They will introduce a very tiny tube into a very specific place in between the backbones in your spine. And they will stick that in place so that you can have some anaesthetic to numb the area. So it aims to numb the bump from a sort of midway point to the top of your thighs. So it's the only thing that actually takes pain away rather than just helps you relax. Okay. It lasts for as long as you need it because the tube is taped in place, and you control it with a button to top up your pain relief when you feel you need it. So when you press your button, it gives a dose of the pain relief down the tube, and it helps to keep the nerves in your back nicely bathed with anaesthetic. It takes around 20 minutes to set up and another 20 minutes to get to full effect, and then it lasts for as long as you need it. At the end of your labour, then we just take the sticky dressing off and remove the tube, and you get your legs back and you get your feeling back within about 2 hours. So at the bottom you can see somebody with a TENS machine on, and that's 4 sticky pads, 2 that go either side of your spine where your bra strap would be, and 2 that go either side of your spine just above your sacral dimples at the base of your spine. And these transcutaneous nerve stimulation, TENS or TNS it's sometimes called, is something that you'd need to hire or buy to organise yourself. We don't actually have them in the hospital, but some people like to use them. The evidence is probably a bit on the fence. Most people would want something in addition to a TENS machine, but until you try it, you can't really know how much it's going to do for you. So it works by kind of stimulating your own production of endorphins, your natural hormones for pain relief. So the sooner that you put your TENS machine on in labour, the more effect that it's going to have for you. And it's a battery operated box where you press a button to send tingly nerve stimulation through the pads to boost your natural secretions of endorphins. So TENS machine is something that you can organise yourself, and you can combine that with lots of other things. You can't really wear it in water, that doesn't end well. On the right hand side you can see somebody using a different position. So there's somebody with a birth ball kneeling over the birth ball, and like we've said before, changing position can actually be a good form of pain relief and a way of keeping comfortable. So being able to move around and shift your position is a good way to cope with labour. Underneath that, I've put a needle and syringe because we have got some injections that we can give in the hospitals of pethidine and morphine, which can help you relax. They don't take pain away, but they can help you to cope with what you're going through. And underneath that are some pictures just for areas where people might like massage. So massage to help drop the tension out of your shoulders, massage across your back, or lower spine or buttocks if you're getting a lot of backache and you're holding a lot of tension there. So do whatever feels good. You also might like to bring something to use as a heat pack or a hot water bottle in early labour. And as long as you haven't got an epidural, that should be safe throughout your labour too. If you have an epidural, it's difficult to tell how hot your hot water bottle is, so we need to be a bit more cautious with that. If you get a good epidural, you won't need your hot water bottle. And in this last slide, I've given you an overview of all the pain relief that's available in the different places. So whether you're at home, whether you're in the birth centre, or whether you come to hospital, there's a kind of overview of all the things that I've just said. One thing to remember and one thing to know is that evidence points towards the massive effect of having a supportive birth partner. So there's huge benefit to labouring women from having a supportive birth partner that stays with them throughout labour. And evidence points towards that being one of the best forms of pain relief and the thing that gives women the most satisfaction. So don't underestimate your role as a birth partner. It's really, really important. Somebody that stays with you is a really, really useful thing. Your midwife will guide you on your pain relief options, and you can also have a look at some of these websites that we're showing you now for more information.